Hello everyone, so today I am going to teach you about how you can make a peripheral blood smear, right, for the examination under microscope. So let's learn how to prepare peripheral blood smear. Alright, so for the preparation of peripheral blood smear, you need the following materials, right. First of all, you need a 75 by 25 millimeter thickness glass slide, right. You need a glass slide. Then you need an anticoagulated EDTA blood or finger prick capillary blood. And you need a second spreader slide, right? You need a second glass slide also, which is known by the name spreader slide. You need a wooden stick or glass capillary to put the drop of blood over the slide. You also need a fixative, methyl or ethyl alcohol for the fixation of prepared peripheral smear. And finally, you need a stain for staining the slide and see it in the microscope. Alright, now we will see the steps of peripheral blood smear preparation. So the first step is that you have to put a small drop of blood in the center line about the 1 centimeter away from the one end of glass slide, which you can see in this diagram. You have to put a drop of blood over the one end, right, in the center line, that is 1 centimeter away. And now you have to be clear that slide should be clean, dry and grease free, right. And then you need to place a second spreader slide at the 30-degree angle in front of blood and then draw it back to touch the drop of blood. So what will happen, the blood will spread across the line of contact of the two slide, right. And now you can do a smooth and forward movement to prepare a peripheral smear. You need to do a smooth and forward movement of spreader glass slide, which you can see in this diagram. You need to spread a spreader slide over the glass slide so that peripheral smear will be prepared. And now you have to fix this smear in the absolute methyl or ethyl alcohol, and after fixation stain the slide and see it in a microscope. So these are the steps of peripheral blood smear preparation. In this way you can prepare a peripheral blood, fix it and stain it and see it in a microscope. Some important notes: make smear and the stain within 2 hours of blood collection, ideally, right. Ideally within 2 hours it should be prepared, and length of smear should be 3 cm. And don't raise the spreader above the slide surface till the whole blood is spread out. And why we do the fixation? Fixation is done to prevent the washing of smear from the slide, right. It will fix the smear. And you have to take care that methanol should be water free, because if methanol contain water, then the sharpness of cell morphology will be lost and you will have vacuolation in the red blood cell. So it might interfere with the reporting. And well spread blood smear criteria is below, which are the criteria that you have made an ideal blood smear. So the ideal blood smear should be tongue shape. It doesn't cover the entire area of slide, right. It should have thick and thin area with a gradual transition as well. So these are the criteria of well spread blood smear, right. Fourth criteria is it should not contain any lines or hole, right, and it should have smooth tail. So these are the some criteria for ideal blood smear preparation, which you can see in this diagram. This is the ideally prepared blood smear. Now, which are the indication of preparation of such blood smear? Which are the uses? So first of all, you can diagnose a certain blood parasites like that of malaria or leishmania. With the peripheral blood smear, you can diagnose certain type of leukemias as well, like that of acute myeloid leukemia, acute lymphoid leukemia, CML, etc. So in this way, you can classify the blood cancer, leukemia as well. So that is the main use, I think. And in case of an thrombocytopenia, blood smear examination also helpful. The peripheral blood smear helpful to monitor the effect of radio and chemotherapy, right. It's also useful in the investigation in case of a bacterial infection, in which vacuolation can be seen in WBC, right. Neutrophil will be increased, so in that way it is useful. A differential diagnosis of anemia also can be made, and it can be helpful in the diagnosis of infectious mononucleosis as well. So these are the some indication. of a peripheral blood smear preparation. Now in this particular video I will show you how to prepare a peripheral blood smear. This is a short video to learn how to prepare a peripheral smear. It's a live demonstration. Just see it. We have put the drop of blood at 1 centimeter away from the glass slide, and now see, this is the second spreader slide, right? We will do the smooth and forward movement to prepare a smear. Alright, thank you very much and see you soon in the next video. Till then, take care.